Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
The nurse in the perioperative area is preparing a client for surgery and notices that the client looks sad. The client says, "I'm scared of having cancer. It's so horrible and I brought on myself. I should have quit smoking years ago." What would be the nurse's best response to the client? 1. It's okay to be scared. What is it about cancer that you're afraid of? 2. It's normal to be scared. I would be, 2. We'll help you through it. 3. Don't be so hard on yourself. You don't know if your smoking caused a cancer. 4. Do you feel guilty because you smoked? The correct answer is 1. Acknowledging the basic feeling the client expresses fear and asking an open-ended question allows the client to explain any fears. The other options dismiss the client's feelings and may give false reassurance or label the client's feelings. The client should be encouraged to explore feelings about a cancer diagnosis. When developing a community-based service program for clients with chronic mental illnesses, which of the following is the least important? 1. Partial programs. 2. Psychiatric home care. 3. Residential services. 4. Long-term hospitals. The correct answer is 4. For a community-based program, the need for long-term hospitalization is least needed if the other services, such as partial programs, psychiatric home care, and residential services, are available and accessible. An infant has been transferred from the ICU to the pediatric floor after undergoing surgery to correct a heart defect. Which tasks can the charge nurse delegate to the licensed practical nurse? Select all that apply. 1. Administering oral medications. 2. Administering IV morphine. 3. Obtaining vital signs. 4. Morning hygiene. 5. Circulation checks. 6. Discharge teaching. The correct answers are 1, 3, and 4. The RN scope of practice includes assessment, planning, implementing, and evaluation. Only aspects of care implementation may be delegated to the LPN, and the exact skills that may be delegated vary by state and institution. In general, LPNs have been trained to perform the tasks of administering oral medications, performing hygiene, and recording the intake and output. LPNs may also take vital signs to gather data, but the RN must interpret the data. Administering IV morphine requires assessment of the client's respiratory status before, during, and after procedure. It should be done by the RN. Circulation checks are assessments the RN should complete. The nurse has assisted the physician at the bedside with insertion of a left subclavian, triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done. A client is being discharged before complete stabilization of symptoms. When developing a discharge plan for this client, the nurse should ensure that the client will have 1. More medical consultations after discharge. 2. Monthly outpatient visits. 3. Many coordinated services. 4. A caring and supportive family. The correct answer is 3. Many coordinated services are needed, including medication management, more frequent outpatient visits, day treatment, or some combination of these, to decrease the risk of relapse, which is common among chronically ill clients. Medical consultations, if needed, would be included in the coordinated services provided. Chronically mentally ill clients who are discharged early before becoming truly stable typically require more than monthly outpatient visits because of the high risk of relapse. A caring and supportive family is ideal for all clients, but not always available. A female client diagnosed with lung cancer is to have a left lower lobectomy. Which of the following increases a client's risk of developing postoperative pulmonary complications? 1. Height is 5 feet 7 inches and weight is 110 pounds. 2. The client tends to keep her real feelings to herself. 3. She ambulates and can climb one flight of stairs without dyspnea. 4. The client is 58 years of age. The correct answer is 1. Risk factors for postoperative pulmonary complications include malnourishment, which is indicated by this client's height and weight. It is thought that emotion responses can affect overall health. However, not verbalizing one's feelings is not a contributing factor in postoperative pulmonary complications. The client's current activity level and age do not place her at increased risk for complications. When preparing a multigravida client who has undergone evacuation of a hydatidiform mole for discharge, the nurse explains the need for follow-up care. The nurse determines that the client understands the instruction when she says that she is at risk for developing which of the following? 1. Ectopic pregnancy. 2. Choriocarcinoma. 3. Multifetal pregnancies. 4. Infertility. The correct answer is 2. A client who has had a hydatidiform mole removed should have regular checkups to rule out the presence of choriocarcinoma, which may complicate the client's clinical picture. The client's human chorionic gonadotropin levels are monitored for 1 year. During this time, she should be advised not to become pregnant because this would be reflected in rising human chorionic gonadotropin levels. Ectopic or multifetal pregnancy is not associated with hydatidiform mole. Women who have molar pregnancies have fertility rates similar to the general population. Which of the following clients has the least priority for admission to a psychiatric healthcare facility? A client with a 1. Potential for self-injury. 2. Potential for injury to others. 3. Grave disability. 4. Decline in functioning at work. The correct answer is 4. Although all of the options are commonly true, the primary reason for concern is that parents commonly provide financial support and housing for their chronically mentally ill children. The most critical needs after loss of the parents are the lack of financial support and housing, which are hard to replace. A client who underwent a left lower lobectomy has been out of surgery for 48 hours. The client is receiving morphine sulfate via a patient-controlled analgesia system and reports having pain in the left thorax that worsens when coughing. The nurse should 1. Let the client rest so that the client is not stimulated to cough. 2. Encourage the client to take deep breaths to help control the pain. 3. Check that the PCA device is functioning properly, and then reassure the client that the machine is working and will relieve the pain. 4. Obtain a more detailed assessment of the client's pain using a pain scale. The correct answer is 4. Systematic pain assessment is necessary for adequate pain management in the postoperative client. Guidelines from a variety of healthcare agencies and nursing groups recommend that institutions adopt a pain assessment scale to assist in facilitating pain management. Even though the client is receiving morphine sulfate by PCA, assessment is needed if she is experiencing pain. The concern is not to eliminate coughing, but to control pain adequately. Coughing is necessary to prevent postoperative atelectasis and pneumonia. Breathing exercises may help control pain in some circumstances. However, most clients with thoracic surgery require parenteral opioid analgesics in the early postoperative period. Although it is necessary that the PCA device be checked periodically to ensure that it is functioning properly, if the machine is functional and the client's pain is not relieved, further intervention, beginning with a pain assessment, is indicated. A 38-year-old client at about 14 weeks gestation is admitted to the hospital with a diagnosis of complete hydatidiform mole. Soon after admission, the nurse would assess the client for signs and symptoms of which of the following? 1. Pregnancy-induced hypertension. 2. Gestational diabetes. 3. Hypothyroidism. 4. Polycythemia. The correct answer is 1. Hydatidiform mole is suspected when the following are present: pregnancy-induced hypertension before the 24th week of gestation, brownish or prune-colored vaginal bleeding, anemia, absence of fetal heart tones, passage of hydropic vessels, uterine enlargement greater than expected for gestational age, and increased human chorionic gonadotropin levels. Gestational diabetes is related to an increased risk of preeclampsia and urinary tract infections, but it is not associated with hydatidiform mole. Hypothyroidism, not hypothyroidism, occurs occasionally with hydatidiform mole. If it does occur, it can be a serious complication, possibly life-threatening to the mother and fetus from cardiac problems. Polycythemia is not associated with hydatidiform mole. Rather, anemia from blood loss is associated with molar pregnancies.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.